The signing of the Patient Protection and Affordable Care Act on March 23, 2010, marked the most sweeping healthcare legislation since the enactment of Medicare and Medicaid in 1965. The role of government in healthcare has been steadily increasing for decades. During this time, there have been at least 5 significant employer-related healthcare laws. Today, government funding as a percent of total healthcare spending is 50%. Effective January 1, 2014, a new era of shared responsibility begins, in which employers will be required to directly participate in providing health care to workers, either through the offering of a minimum essential health plan or through taxes levied by the federal government. The number of Americans accessing health insurance through some type of government program is increasing. Today, more than 35% of Americans access health care insurance through Medicaid, Medicare, or a military-related program. Almost 10% of Americans purchase coverage through the individual insurance market, and more than 16% have no health insurance coverage. 55% of health insurance coverage is accessed through an employer plan. Overall healthcare spending continues to increase. The healthcare economy is complex and most would argue inefficient. In 1995, healthcare spending represented 13.6% of gross domestic product. Also in 1995, the obesity rate was 15%, the over age 65 population was 12.6%, and the median age was 32.9. By 2010, the obesity rate climbed to 35.7%, the over age 65 population increased to 13.1%, and the median age reached 37.2. These factors contributed to healthcare spending reaching 17.59% of gross domestic product. The healthcare reform law, now referred to as the Affordable Care Act, was passed in 2010. In 2011, many popular provisions were implemented, including coverage on a parent's plan until age 26, preventive care services covered in full, no lifetime limits, and the elimination of pre-existing conditions. On June 28, 2012, the Supreme Court of the United States issued its opinion on the constitutionality of 2 key components of the law, the individual mandate and the expansion of Medicaid. By upholding the individual mandate provision, the court removed key uncertainties and the law moved forward. 2013 was a transitional year, which included W-2 reporting, new plan fees, and summary of benefits coverage disclosure. In 2014, full implementation of the law goes into effect with the availability of public health exchanges, individual mandate requirements, new underwriting rules for insurance companies, and new taxes. 2014 introduces a new era of shared responsibility, which includes participatory tax requirements for individuals and employers. The individual mandate requires that all Americans maintain a bronze-level health plan or pay an annual tax that begins at $95 per person per year, or 1% of household income, and increases to $695 per person per year, or 2.5% of household income in 2016. A health plan with a deductible of $2,750 and 30% coinsurance is a good representation of what might qualify as a bronze-level plan. An employer must offer a group health plan that provides minimum value and offers affordable coverage. If they choose not to offer a health plan, an annual tax of $2,000 per full-time employee is paid. If some, but not all, employees fail to have a plan that is affordable and with minimum value, the tax is $3,000 per year for each employee who falls into this category. So what are the shared responsibility requirements? Depending on the size and type of employer, the requirements of the Affordable Care Act will vary. An employer must offer full-time employees a plan with minimum value and affordable coverage. An affordable plan is one in which self-only premiums do not exceed 9.5% of W-2 wages. A plan that provides minimum value must pay 60% or greater than actuarial value as defined through regulation. An employer with employees who earn less than or equal to 400% of the federal poverty level need to be mindful of the interplay with yet-to-be-implemented public health exchanges and even Medicaid. If an employer has fewer than 50 full-time employees, the mandate to provide health coverage does not apply. Also, the mandate does not apply to part-time workers, though the regulations around this issue are complex. The Affordable Care Act is having a profound impact on employers, healthcare providers, and individuals. The Fidelity Group stands ready to help you navigate the complexities of this law.